Maryland office for Gallagher. Teresa joined Gallagher in 2000 and has over 20 years of experience in all aspects of health and welfare benefit plans, specializing in the mid to large market. Welcome, Teresa.
Thank you.
Glad to be here with you. And we are missing Wayalia Chase, who is the Director of Partnerships and Corporate Engagement at Leadership Montgomery. If you're listening out there, Wayalia, we miss you here, and we're going to try to interject some of the programs that you have at Leadership Montgomery that can help ease the stress of employees in different companies. So we move to our learning outcomes. And our learning outcomes are quite simple today, but very, very important if we want to create effective organizations that keep talent on board. So the first learning outcome is to describe resilience. We also want to describe and identify opportunities to encourage resilience. And we want to identify practical techniques for self-care and the role of managers in those. We also want to present signs to identify possible red flags so that we have time to address them, and discuss tools that everyone in the organization at all levels can utilize to build resilience and lower stress levels. So our next slide is one we like a lot that says surviving is not thriving. And that really says a lot by itself. So it expresses why resilience is so important for all of us. And burnout, I'm struggling changing my slide, so bear with me as I change the next slide. So according to the World Health Organization, burnout is syndrome. Okay, we went back to the slide. According to the World Health Organization, burnout is a syndrome conceptualized as resulting of chronic workplace stress that has not been successfully managed. So we're using a text definition to put what we're going to discuss today in context. So what events introduce stress at our workplace? Who wants to help answer this question first? What events introduce stress at the workplace?
Well, that is, a great question, because the answer is probably as varied as the people that you would ask that question to. Stress and stress factors and the way that stress affects us is very individual. And so from just the ability for someone to get up in the morning and go to work, dealing with just what they need to do to get themselves together and ready for work. Traffic introduces stress. It may even be just simply leaving the house, and it could be something very basic, like trying to get that's not basic, trying to get your children to school before going to work. I mean, there's a myriad of things that happen, if you think about it, even before we hit the workplace. Once we get into work, there of course is just the current workload that we all have, along with I'll put them into big buckets, right? So that's workload, performance, compensation, interactions with leadership and peers. All of those things and all the activities that relate to that are stressful. And depending upon the person that you ask, they're going to tell you whether it's more or less stressful for them. But it all actually affects people in a stressful manner. And I think what's also important to remember is that even in times, this isn't always necessarily when things are quote unquote bad. So, stress can come from a positive experience, a new opportunity, new work coming in, a new client. You're just really happy, and you're getting a lot of things done. That's also stressful.
Yeah, I'd like to emphasize something that Jennifer just mentioned there at the end. The stress researcher Hans Selye wrote the classic book on stress a number of decades ago, The Stresses of Life. And in it, he makes a distinction between distress, which is the kind of stress that tears us down over time, and what he called eustress, which is the kind of stress around things that we get excited about, the things that we feel good about. if you're training for a race or you're getting ready for a work task that you're really looking forward to, there is a kind of energy and emotionality that goes into it, but it's toward a kind of meaningful purpose. So that kind of stress actually serves us well in our work. So I think this is a really important distinction for us to maintain as we go through our conversation today.
So not all stress is bad. There's some of it that can be good. But now we have in front of us burnout indicators. So there are times when maybe it's a combination of good and bad stress that starts kicking in, and people feel that just like a light bulb, feel burning out.
And you don't necessarily see it coming. Sometimes it's the kind of stress where you're working, you're feeling great, and then all of a sudden, just one day, it hits you, and however, there are indicators that happen, and sometimes we're just so mired in what we do that we don't often pay attention to them, or those around us, don't pay attention to them. But, as you're about to go into those things, there are things that we can actually see and help us to avoid the burnout.
Mm-hmm. Actually, we're going to quote a study by Deloitte, and their findings are really very interesting. So 77, they research U.S. professionals across the country, and 77% of the respondents say they have experienced burnout at their current job. That's very high from my point of view. Employers say they are missing the marker when it comes to developing well-being programs that their employees find valuable to address stress in the workplace. And 1/3 of employees do not feel comfortable taking vacation time.
There's a lot of truth to all of that. I think that the 77% of respondents say they've experienced burnout at their current job. I might even say that that's probably underestimated a little bit in terms of, again, the burnout factor. And I think that there's times when, yes, we recognize it, and there's times when we don't. And so the whole point of being able to know yourself, being able to provide self-care and understand when you are feeling burned out, maybe those people who said, no, I wasn't feeling burned out, but yet if you ask them, have there been times when you just kind of feeling unusually tired? Are there times when you've woken up in the morning and it's more difficult for you to go to bed? Are you sad? Are you eating more than you normally do? Are you not able to maybe enjoy some of the things that you normally would? That actually can be a sign of burnout that people aren't attributing to that and perhaps attributing to something else.
Right. And that can come from many directions. That can come in healthcare, from providing the services that we provide. And we were discussing before that here at Montgomery Hospice, we pay close attention to when our clinicians need time off, because they are exposed day in and day out to a lot of grief, a lot of what I call secondhand trauma. And there's the times when it's too much, and I think it's very important that managers pay attention to that. And you do that too, Kip, with your staff.
Yeah, I think one of those indicators that was on the previous slide is hugely important, and that is energy level. I think the first sign that we're starting to experience burnout or we're feeling overwhelmed often manifests at the level of energy with which we have for a job. So one of the things that I'll do with the bereavement staff, the great group of colleagues that I work with, is if I know that the previous day was a hard day or a long day, or they had to work that evening, the next day I may
and the ability to manage that as one of those things. We often look at compensation, we look at benefits as a whole in terms of trying to add health and welfare program components, but when we're specifically trying to address specific needs, just as if you were looking into your workplace to find out what types of maybe medical issues or things that you might want to help address with your staff, stress is definitely a big one. And that's one where I think that we can all do more work in trying to add programs that will help.
I was suggesting that sick days could be used for an overload of stress. But somebody said to me, your sick days are sort of your insurance policy for when you are really sick. You cannot take it to prevent sickness. But somehow that equation seems strange to me, that you cannot take a sick day to prevent further sickness. You have to just get sicker, and then you take more days to get better.
Well, but that again is, however, the employer is creating that policy. Right, it's organizational. And so, being in an organization, MS is one of them. We do not have separate sick days and separate annual leave days. We have, paid time off. And those days you can use for whatever you need to when you feel as though you need to take time for yourself or to care for somebody else. Because, of course, the ability to care for someone else can also add stress to the workplace. It could also be, more preventative than that. We also have comfort rooms, and our comfort rooms are places where staff can just go if they need to take time for themselves, for to get themselves together, if they have a headache, to lay down, if they just are feeling overwhelmed, or if they just want some peace, they want to meditate, they want some calm. So we have those in the office as well, which will hopefully reduce the amount of time that they would need to take.
Right. We do the same thing. We call it a quiet room. Yep. You can go use it for whatever you'd like, but it's just a place to kind of regroup yourself, take a step away if you're intensely working on a project or you've got other things on your mind that you brought to work that day, because that can happen as well. And then you just give yourself a checkout box a little bit.
We have, employers who bring dogs in, that help reduce stress that way. It's amazing. It's another thing that we do. You have the visiting dogs that come in, and it's just amazing how people will just drop what the busiest person in, the office will drop what they are doing to pet a dog. And it's just fascinating how they'll wave everybody else by, but when the dog comes by, that's
immediate therapy.
Yes, and that is just taking time out for yourself, and that self-care, taking a walk when you need to also. And of course, employers, by making this known, because, the fact that we can just get up from our desks and go and take a walk outside, if you're, able to do that, we get tunnel vision.
We do the same thing. Encouraging employees to feel flexible and comfortable doing those activities is also at the management level, making it kind of reinforcing that it's okay to take these breaks and help with your self-care.
Absolutely. We have additional findings from this study that we are referring to, that employee burnout has no boundaries, that passionate employees are not immune to stress or burnout, that organizations may not be doing enough to minimize burnout, and that companies should consider workplace culture not just well-being programs, but it's bigger than that. And burnout affects millennial retention. And we talked in other programs how different it is to try to retain the talent of millennials, that they don't really want to work for you, they want to work with you in one purpose, and other very meaningful, very realistic expectations. I think they are making the workplace better for all of us with those expectations. So the impact of burnout on healthcare. So it pertains to patient care. It's likely that compassionate can be reduced, sometimes higher hostility, lower patient satisfaction, higher incidence of medical errors, all real bad outcomes. And the healthcare system, I can't pronounce this word,
absenteeism.
Thank you, and professional behavior, poor quality of care, and productivity going down. So these are outcomes that nobody wants. And in this presentation, we're going to tell everyone how to avoid them. We have all the tools. I also want to encourage the audience to not believe this part because we don't have all the tools, but we have some ideas for you. And we encourage you to please use the chat box on the right hand of your screen to send us questions because we want to make this interactive as possible. So we have a slide showing burnout and resilience and how one affects the other, and they feed on each other. And Kip, I think we were talking about defining resilience in different ways. So what is resilience? I'm going to ask my panel.
Well, you can offer a general understanding that resilience is our capacity to draw upon the resources that replenish and renew us. But I would want to add to that, too, that resilience isn't only an individual matter, that departments can be more or less resilient, organizations can be more or less resilient. And resilience is really a two-way street between staff and management. It's always contextual, and we don't want to present resilience as just an idea to criticize individuals who may be in very difficult work environments or have been in a low morale situation and say, oh, if you're just resilient enough, you'll be able to get through that. When in truth, even the most resilient individual can find it difficult being in workplace situations that are difficult. So resilience really is a two-way street, and we have to look at not just individual resilience, but the ways in which organizations, that staff, that management can encourage resilience across the organization and own responsibility for that.
And we have on the screen the Gallagher definition. Teresa, do you want?
Yeah, so that's just the ability to withstand, recover, and grow. So just identifying, and to Kip's point, it's not just about identifying and withstanding, because anybody can say maybe they think they're resilient, but how do you manage that with other stressors? And when you are in the workplace, it's not just you that needs resilience, it's a manager's resiliency, it's the cultural aspects that also help with that resilient person or perception.
Yeah, we tend to see the person as they are being more resilient or not, but not seeing the entire unit as a whole, as how we interact with each other. Nobody's not resilient in isolation, but it's connected to everybody else. So what do we know about resilience? That it's not all nature, that we can learn and develop it, that we can have it at some time, which means we can lose it at other times, that it's about support and staying connected, and that it's about meaning and creating purpose, that we don't necessarily transfer resilience from one situation to another. And as I look at this, I think in the resemblance to the grief journey, and can probably talk about how we cope with grief in similar ways.
Yeah, and I think resilience is a much better ideal than balance. We've heard for a lot of years now this balance offered as an ideal, and I think that's unrealistic in life, that in life and in our work, there are times when we have to expend ourselves and push ourselves and stretch ourselves. And the notion that you can be balanced at all time and in every moment is just not part of the human situation, and especially the work situation. So resilience says that when I expend myself in work, that I will be able to get in touch with the resources. My organization will have the resources to be able to bounce back and go forward. And as Teresa said, to find ways to grow out of that as well.
So, and it's interesting because, we're talking about this, and I keep going back to just the idea of resilient teams and resilient organizations, and just how important it is that you have groups that are reporting to you, that are working with you, that are able to support one another. And, to what we're saying, individuals at times have moments of resilience, but even your most resilient person has times when they need that support. And that's where the resilient teams makes all the difference and allows for projects to still get done, work to still get done, and for that person to not just be supported, but for someone else in that team to be able to say, hey, here's someone who's on my team, and the team notices that someone is needing some additional support and they are forgiving. And so we're also not looking at someone that's in a team environment who may have a moment where they need support. We don't also look down on that person. We actually help to build them up because we all learn, especially as we're working with one another. We all have our times. We all have our times when we step up and we help out the team. You know, we've heard take one for the team, you know, but we do it, and we do it willingly because we know that other people have taken one for us as well, in order to keep the team going. So I just keep going back to just how critically important it really is to not just have individuals that are resilient, but to have teams and groups of people working together so that that can be a self-supporting and self-sustaining relationship.
I would say as a manager, if there's an individual on the staff that I'm working with that's struggling around resilience, my first reaction should be, what am I missing here? What am I needing to do that I'm not getting? It's almost, this is a bit of an overstatement, but maybe not. When someone on our staff is struggling with resilience, we're struggling as managers. We're not succeeding in that way. So finding ways of that team approach, finding ways to kind of gather around, but also letting those folks that are struggling feel heard, and looking for ways for them to be empowered is going to be hugely important in any given team or work situation.
I love that you're saying that this is not a problem of the employee, but it's a problem of the manager. If all managers were to own resilience as their job to foster it, I think a lot of these numbers would change in the statistics.
Well, yeah, I mean, you look at what are the things that managers can do to help reduce the stress that employees face. And when you look again back at those buckets, things like work performance, is a employee wondering, am I doing a good job? Am I not doing a good job? What's my next, step in terms of my career path? What type of feedback should I be getting? These are all things that managers have direct influence over in terms of communicating, talking to their staff, and making sure they understand how their performance relates to their job. And even if their performance is not good, you can still reduce the stress of what's going to happen just by having that communication and letting them know. Similarly, when it comes to work and work product, who is in charge of the amount of work and work effort, that is being placed upon our staff? Managers, exactly. And so by, not only knowing the work that is on, your employee's plate, but also being able to say to whoever that work is coming from and being the advocate of, hey, look, here is what we currently have. Here is what else apparently needs to be done. We need to have a conversation because here's how the team is being affected.
Managing workflow. And again, at our office, one of the roles of the client service lead, that's what she does with the service team, is she'll do weekly check-ins with each individual. So not only are you looking at it from a group perspective, but she's doing these weekly check-ins to do that. What is your workflow this week? Do you need someone to step in, and making it okay for someone to step in and fill a gap if you kind of can't keep things done? And it keeps everything productive, but it also empowers everyone on the team. And everybody feels like a team player. I mean, there's nothing better than also helping someone that might be struggling and making that acceptable. Is great.
And then when there finally is that downtime or someone says, hey, I'm going to take a vacation, having that talk with them about, and you will not be checking your email when you're on vacation, and you will not be, but just having that, because we all know we have those employees, but their idea of vacation is do everything, that they would be doing at work just while away because it makes them feel better, because they don't, because they just want to stay connected.
You're disconnecting too.
Exactly. And as a manager, you have every ability to say, not this time, just take a break.
Absolutely. I'm guilty of checking the email when on vacation, so I'm taking it in.
It takes me about 48 hours of not checking it to go, to say, you know what?
I can move away.
Exactly.
Everything will be fine if I'm not there.
So we have a quote here: managers who are confident and resilient develop an optimistic perspective and encourage the same trait in their team and staff. So it's what this quote is saying is that the birthplace for fostering a resilient team is having a resilient manager who actually understands that it's no different from compassion. We can't extend compassion unless we feel compassion for ourselves.
And I would add too, it's very important for managers to think about what animates and what tasks staff find meaningful. What they're passionate about. Sometimes they'll tell you the things that they're passionate about and they're eager and interested in. Sometimes you can read it on their face in the way they talk about things or their demeanor. They get very excited when they talk about it. And we saw this just in the beginning poll question about what people enjoy about work. Just a cursory read through that, and you can see that it was all people connected and finding those things that they're passionate about. No one said, oh, the thing I love about work is the commute or the paperwork or things like that. It was really about the connection and how that feeds into the sense of meaning and purpose. So part of our fostering resilience is listening to our staff for the things that they find meaningful and providing opportunities for them to connect their work to that meaning.
Connecting. And if Waialia was here, she would tell us about the CVC programs that they have at Leadership Montgomery, where outside of the workplace, they connect through supporting meaningful organization, doing meaningful work. And we are, as Montgomery Hospice, also considering doing this program because of the positive effect it has in building this kind of connectiveness. And you've done that extensively at the MS.
The company. No, exactly. And so just finding those areas that are value added for your staff, the people who, again, want to be engaged, they want to be connected, and then try to help kind of bridge the gap that sometimes happens when staff can't see the meaning in their work or why they are here doing things. And so doing things like having a employee volunteer program at MS helps significantly. Our mission is to improve public health. And so a better way, to further that than to also create an employee volunteer program where employees can spend meaningful time doing community service work in the communities in which we work and live and serve, and also help to, improve public health in that way. But above that, I think that there's opportunity for any company, regardless of what their mission is, to find value through, again, this teaming, this sense of resilience, seeing resilience in others. Doing something like community service allows you to see the resilience in other people. And that, I think, is something that is rewarding, it's contagious, it's something that helps build up our own self-esteem as well.
Yeah, and for the audience, Leadership Montgomery offers these programs, so we will give you in the resources their website and more information about these programs. We have an image here. Lonely is not being alone, it's feeling that no one else cares. And what a better way to care for one another than to get to know one another outside of the workplace. So organization well-being, creating an organization of trust and authenticity. We can use many tools as the Employee Assistance Program, and one of my favorite ones, employee health benefits. So Teresa, tell us, how can we build a well-being in the organization using our health benefits?
A good thing. So employee EAP program has a lot of additional resources that are confidential, so the employer is not seeing a list of reports of who's calling in, what that reference is. You can call out work-related issues. Oftentimes we use the example, you can call if you're having difficulty communicating with the manager, and you maybe are not ready to go to HR, you need to outreach to someone to get some constructive way to handle the situation. Really understanding your employee benefits is going to be key. There are a lot of resources in the medical plan as well as the dental that offer some we would call resiliency. So knowing what your mental health provisions are, how often can you use them, using telehealth. I think we talk about this in a couple more slides, but really educating and knowing what are the additional resources that are already included in that health plan that could offer assistance. Now, how are the employees going to understand this? This is, again, going back to your leaders. They need to employ the education component around this, making sure that it's abundantly clear that these are the resources that are available to me as an employee of the organization.
And we want to take a poll with our audience today. We want to ask a question, and our question for the audience is, how well do you know your health benefits? And you can type this on the chat box on the right hand of your screen. And how well do you know your health benefits? Do you know all the health benefits that your organization provides? Do you only know? Oh, wonderful, Gail. You know it very well. That's awesome. Yeah, it seems that people know. We had a great orientation at our health benefits. That's wonderful. I am so glad to read that people are doing a good job at explaining the benefits, and that people have used the EAP and that they know. Seems that this audience is a very well-informed audience.
And that is very encouraging to see. I have to say that in my experience, I found that the majority of employees, other than when they first come in the door, and they may have new hire orientation, or, if they're looking to change their health insurance, or there's been a change during open enrollment, they really don't go back and revisit, right? And so it is now March, and I think that's great that people know their plans. And, there's a lot of nuances to health insurance also in the benefits, and so it's the time to explore those a little bit further. Make sure you're knowing all of the benefits that you have is actually when you don't need them.
Correct.
Would you agree with that?
That's what we also say. Maybe join a mid-year education. So outside of open enrollment is oftentimes, which plan do I want? Is my payroll deduction increasing, and are they changing providers? Do I need to change a provider? Those are the key things they're focused on. They're not thinking about all the other benefits. I mean, we even get into dental well-being and how that can relate to so many other health issues, just knowing that it's, that you have 2 cleanings a year, or whatever your plan provisions might be, understanding that and making sure. So I'm glad all these people are saying, yes, they understand their benefits. But as managers and leaders, making sure that maybe you understand it, but also the people that you're managing or working on your team can understand it as well.
Yeah, because a lot of times people even won't seek out care because of a misunderstanding or, of what their benefits are. And so, and so if there's any way that people can be reminded, to your point, Teresa, about letting people know, and managers talking to their staff and encouraging them to use the benefits is extremely helpful.
Right, and we have a very good testimonial here of EAP was so helpful because it offered counseling right away versus waiting for a therapist through the insurance. And that's wonderful to hear that not only are people aware of their benefits, but they are using them. One thing that we have done here at Montgomery Hospice with the help of Gallagher is improve our health plans for our staff. We did numerous surveys, and we continue to do that. You want to talk a little bit about that, Teresa?
So engaging these staff. So what we like to say is, what does that employee value when they come in the door? And it's not necessarily the same thing. And again, with 5 generations in the workforce, what everyone values when they walk through the door is definitely not the same thing. So identifying that areas of concern, areas of what they thought were maybe deficiencies, helped us craft different well-being initiatives. And well-being is not a wellness plan. That is a component of well-being. As we're talking today, resiliency is everything in the organization. Your feelings of importance and purpose. It is not just what does my health plan offer. It is everything around that. It's so much more. That's just the basic.
So, for instance, at Montgomery Hospice, we realized that many people would welcome acupuncture. So we built our health plans to allow for a number of acupuncture sessions, and that was very well received. We are hoping to include nutritionist services for next years.
And that, can I just interject right there? So oftentimes too, again, in that medical plan that's being offered through your employer, you probably have discounted resources, which are typically on that healthcare provider's website. So United, CareFirst, Cigna, just to name the top 3. They all have additional resources as a member. And a lot of it's surrounding around additional resources. It could be nutritional, acupuncture, additional visits to chiropractic, discount services for gym memberships. So whatever that means to you, yoga, meditation, there's so many things that round out a person and what that, how they find to handle stress. There's a question about, say more about the EAP. An employee assistance program is a program that does just that. It offers some counseling services to your staff that can be used for yourself or any covered member. Oftentimes you can even use it for your parents if you're maybe taking care of your elderly parents or you have college children. They can all benefit from the program. It just does initial counseling. It can be legal. It could be, I need help finding a child care provider. A lot of mental health is covered under that program. So I would check with HR if you're not aware of what your program is.
Yeah, they also offer services as mediation. If you have a couple of people that can't work together, there's a good facilitator that will help with that conversation. And I was going to say that through this partnership with Gallagher, we are now going to conduct a new survey and try to improve our benefits for our participants next year even more. So the role of EAP, we've discussed that, benefits that are innovative. And we were also talking about, as employers, introducing incentives to help employees take care of themselves. So those physical exams that has no copay, the dental cleanup, sort of maybe try to reward. You were talking about some incentives that you would
some
suggest?
employers will actually offer rewards. So not only is it free to go get your annual physical and maybe your 2 dental exams, but making sure, kind of incentivizing that, sometimes based on data that you say, we have this awesome program, but no one's actually taking advantage of it. So encouraging, and I gave the example last week of gas cards. Not everybody likes a Starbucks card, but everybody needs gas in their car. So maybe giving some simple incentive to encourage them to participate in these wellness visits would help out.
I love the idea of gas cards.
So again, because that's important to you, and just trying to, put all of these things and support them in a way that's meaningful for staff. And a lot of times too, it's like once they start using it, they may have some uncertainties at first, and they're like, you know what, this is actually pretty good. And I think also with the EAP, one of the nice things about it too is that it is confidential, and so staff may also have some misgivings about, well, if I go, then my employer is going to know all of my problems, and that's not the case at all, and that it is very confidential and is discreet. And so also just assuring staff of that can also make a difference.
We also have telehealth, and we were reviewing our plan just a few hours ago, and it's underutilized. Telehealth is definitely underutilized, but as a person who's used it, I encourage the audience to, if you have a telehealth program, the copays are so low, they don't compare. You can have the doctor see you within minutes.
Yeah, and that's the other thing I was going to say, kind of back to the EAP program and telehealth. What is it that's causing the stress? You have a problem. What is it? What is this? What's wrong with me?
Right.
You call, you have a wait list, you're going to have to deal with some more, but just to get someone to almost instantly look and assess what the situation is, or talk to you about it through the EAP or call telehealth, can just take so much stress off, because a lot of times it's the fear of the unknown. It's the fear that it's worse than it is. If you're like me, you will live with something forever, and then the day comes when you can't deal with it anymore, and then you try to call your doctor, and there's a long wait. Shame on me for dealing with it, but it's still nice to be able to use something like telehealth, that when I'm ready to make that call, I can do it.
And that's the thing. The additional part of the telehealth is now that it includes mental health. So it's not just telemedicine. Is you phone or you Skype with a doctor. So right from your house, you can do it from your career station if you needed to, but it's not only used when you're sick. You can use it for things like that. You have a common cold, your child has an ear infection, you have a rash, you use it for those things. But they've added now, because of the awareness and access, telehealth can be used for mental health. So you can actually schedule appointments weekly with the same counselor from the comfort of your own home. You're not taking time off of work to see that counselor. Oftentimes, they're not participating. They have evening hours. You can't get there at 2 p.m. when that's their opening. This has opened the gates for a lot of people to have easier access, exclusive access. I do know one employee who, no shame in his game, he does his weekly appointments on his lunch break at work. That's how he can fit it in. But he values it and feels like it's important for him.
And you get the same provider. You can build the same relationship.
Correct.
That's wonderful. I think everybody should
Yeah.
take care.
And it's probably important to know too that telehealth does come through your company's
Yes, it comes
your
through.
company organization. So telehealth, when we're talking about it, isn't something that an employee can just go out and get in addition to.
Correct. It would have to be provided through your employer through either their health benefit. Again, most of the major providers now offer telemedicine as part of your health benefit, or you could purchase it outside of that.
That's wonderful. And the last on our list is the apps, which you speak highly of, Teresa, that it saves time. It's an easy way to know your benefits. So maybe some of our participants today don't need the app because they know their benefits well, but maybe there's other people in your organizations that may not even be aware that your health provider has an app that describes your benefits in great detail that you can carry in your pocket all the time.
Going back to using the app, not just to schedule an appointment with the provider, but knowing those additional resources would be where the app would be really beneficial.
Yep. So there's other tools that can be used to help with resilience, and we talked about volunteerism, and I can't say enough about the CVC program from Leadership Montgomery. They are by far a wonderful, wonderful way, and Wailea is the person to call if you want to do that for your organization. But also recognizing signs of stress, where you feel it in your body. Is this a bad habit? When stressed, some people get it on the neck, some people get it in the stomach. So many different ways that our body can tell us something is too much for us. So we have developed a wellness committee here at Montgomery Hospice, and the way we were able to do it is because we had a rebate from our health insurance company. So then we had the funds to do something with those funds that was meaningful for our employees. And that has been seed money that has allowed us to offer massage, Reiki, and educational programs for our staff that is very, very well received. Many nurses have said, I really liked working here. You really care about the staff because we can get these 15-minute massage on the neck every so often, which has been wonderful. But maybe you can talk about developing a wellness committee and maybe doing other things like bringing pets to the office.
Yeah, I mean, I think, again, it speaks to what is it that your employees find useful. And, I would hope that with the wellness committee, just like with the employee volunteer committee, you have groups of employees that are speaking to, again, what is wellness, what does wellness mean to them, and what is it that an employer can help to provide that they could take the time to do and to, again, address the stresses that they are feeling. And so developing a wellness committee, I think, is great. We talked about the pets already. I think, too, that, there are a number of food-related and eating things, eating healthy. I think that employers have a lot of influence around that in terms of what is it that's being provided in vending machines if they are there, or if you have an open market. I know at MS we have a marketplace that employees can purchase meals, but we've done our best to ensure that there is the power of choice, So no, we have not eliminated all sugar from the market, but we have added fresh vegetables and fruits. So we've added, freshly made sandwiches. We've added things that, again, give the employee the ability to choose. And we have a lot of information and sessions around good eating, healthy eating. We'll bring in workshops also to talk about healthy eating lunches. And again, not just for yourself, but for families as well, because the stress of what happens after work in terms of what are they going to eat, what do I need to fix them, dinner is the one thing that is kind of interesting. For breakfast and lunch, we normally give our families a choice of what they want. Dinner is usually the one thing that it's like, and here it is. And so, or ourselves. And so if we're going to do that, how then can we best prepare that, and what is it that we could do in terms of bringing services in to even help make dinner easier?
Mm-hmm. So one thing that Gallagher has recommended Montgomery Hospice to do with their wellness committee is to have representation of the staff. In that way, we have the pulse of what people really need, because it's not good if there's 4 of us that keep doing whatever the 4 of us want, but it's really the engagement of the staff that makes it more successful as far as the interventions. And it's part of empowering our employees to ask for what they need so that the company can provide it.
And if I could say too, just in terms of that, it also helps to make sure that everybody feels as though they can participate. If you're thinking about different challenges, is a challenge where it's about walking and running suitable for all of your staff? If it's a challenge that has to do with eating, and how you eat or what you eat, is that suitable for all of your staff? And so really thinking about if you are going to do, any type of wellness activity, just making sure that all the different needs of your organization are addressed with that wellness activity to make sure that, again, everyone can participate and reap the benefits.
That is so true. Because the first year we had the rebate, we bought Fitbits. But I remember being very careful about purchasing Fitbits that would have two advantages. One was to count the number of steps that you had every day. But the number two was to measure the quality of your sleep. Because I don't think it's up to anybody to determine that everybody needs to walk or not walk. That's a very personal decision. But the sleep, I think I'm sort of here in the office, the sleep police. I am constantly asking people how well they sleep, how many hours they sleep. I think sleep is such an underrated tool to improve our wellness. I don't think anybody is making money out of us sleeping without any medication or having a good night's sleep with no aids at all. So that's why it's sort of a well-kept secret that a good night's sleep can go very, very far. But I did some research on this, and it's the number one performance enhancer for any athlete. So if you want to improve the quality of your life immediately, try sleeping half an hour extra immediately, and then move it up to hopefully 8 hours a night. I'm amazed at how little sleep most people get, and that's why I became the sleep police. And we have a slide here that talks about that, a little bit of that. But I just realized, yes, sleep is right there. So the old paradigm, I'm going back to the old paradigm is hard work. Pure hard work is going to lead to success. And the new paradigm is less than half hard work. Sort of a good part of it, exercise, healthy eating, sleep, and time off. And see how sleep and time off are together. There is no surprise that they are almost taking more than a quarter of the whole pie. And I think this is a recipe that managers can take. Because I also find, and I'm going to pose this question to you all here, I also find that managers are setting the tone of the team by how they take care of themselves or not.
Yeah, and I mean, I agree with that 100% in terms of, the way that you carry yourself, deal with work, deal with stress, how late you work, how early you work, definitely is something that's noticed by the team. And the things that you say as a manager in terms of work and when work should be done and when work should not be done is also something that's extremely important. I know for me, and this has just always been, my thing for quite some time, physical fitness is extremely important, and so I intentionally, will go to work, and knowing that at lunchtime I'm going to the gym. I'm going to the gym. And if somebody says, hey, I know I need to talk to you about something, of course, if it's an emergency, there are those things. But I go to the gym and I change, at my workplace, and I go to the gym and I come back with my gym clothes on, because it's important. I feel so much better. And I encourage everyone else, to do the same, that's with my team and my staff. And not only that, but if they say, hey, I am going to the gym at lunchtime, I don't say, but wait, there's something I want to talk to you about, because why should it be okay for me and not for you? And so that's just a very simple example of how what we do does affect what employees now believe is okay. If I have an employee who says, you know what, I just want to go for a walk, I think that they're more open to tell this to me because they know I'm someone who
You're
at
also
one time.
taking time away, so you're making it acceptable to take time away to do something that's good for your health, and
Exactly.
that's something that's important to you. So giving that flexibility, that is so key. We had the same thing. Our manager, our leader, actually, he used to go to the gym too, and they made it acceptable to say you can use the gym facilities that we have on site, and you're not going to be, pointed at when you get back in the door. Where did you go for lunch? And allowing flexibility. And the same thing. Do you want to walk around the building? You can do that.
Right, but I want to take it back to the first time that we used our rebate for wellness, and we bought the Fitbits, and it was intentional that we wanted to measure the quality of sleep because not everybody is.
Well, everybody wants sleep.
Exactly, and no, I think everybody tries to sleep. Everybody should sleep more. But what I'm trying to say is that not everybody needs to walk and count their steps and be focused on that part of that tool that we're mentioning. That everybody needs to be aware of what works for themselves. Mm-hmm. But I am just introducing the idea that sleep is likely to work for everybody. But we also shouldn't push everybody to do the steps.
Yeah, I think being gentle with one another and recognizing that we all are dealing with this, we all are struggling with this on various levels. I think we would want to avoid this becoming the new Puritanism where we, kind of look down on each other about what we're doing, what we're eating, et cetera. So, but recognizing that we're kind of all in this together as a team can become hugely important. I would also like to add to the conversation, sometimes I think it's good to be aware of your own coping style. When you're overwhelmed, what is the default for you? Or do you make decisions that are not in the best interest ultimately? When you're overwhelmed, do you tend to need time alone to process that? Or do you want to be with another person and kind of talk that through? Which way do you kind of lean? So kind of recognizing your own style. Sometimes if we look back at our history and how we coped with losses and stresses, we can kind of see those patterns. But I think it's important for us to be wise about ourselves in the way that we cope with these stresses that can happen.
Yep. Really, really good. There's a question that came up. Given the importance of self-care, is there a reason why EAP departments, counselors are not a staple of every healthcare organization or just every organization that employ human beings? Is it a financial or is there other forms of assistance to EAP being as common as having custodians?
That's a loaded question. It is financial. There is a financial impact on offering the employee assistance program, and it could come down to education at that level of, who they're consulting with. So I hate saying that, but it really needs to be who you're employing as your outside vendors to kind of make some of this to the awareness of your leaders who are making this decision. It should be commonplace, but this, again, I think we're moving in the right direction with more awareness around mental health and outlets, but I agree with you. It's a tough decision as to whether an organization, why they offer it or not. I can't give you an answer.
I think if we were to make a case for returning good talent, all organizations would realize that the cost of losing good talent or lack of support far exceeds providing these kinds of programs.
Yeah.
So.
And it's also one of those programs, too, where, it needs support. Just for an employer to say, okay, now we have an EAP program and not do anything else, they're not going to get the results that are often, that you hear about, that you hear us talking about. So you really, when an employer does put this in, it now needs to be communicated, it needs to be supported, it needs to be encouraged. It needs to be attended, like the people who are, on this call right now have the right idea about that. And that's just the other part of it that often makes it difficult for employers to see the value because they're not, I'll call it, all in when it comes to providing the full complement of supports that go around a good EAP.
We have a comment here. Just read an article that it costs an employer on average $70,000 to replace an RN. Turnover is costly.
Yes, it is, and in more ways than just that number.
Yeah.
You know,
Yeah.
you think about turnover in a team, it affects the other team members as well. It affects the client. I mean, turnover, I think 70,000 is you know, just again a completely monetary portion.
Yeah.
There's how it affects everyone else that works with that person.
Yep. Thank you, Lisa, for that comment. And we have 4 more minutes here, and we want to turn it to the audience if they want to ask any questions. And as you type your questions, I want to tell you that the Montgomery Hospice and Prince George's Hospice Center for Learning is going to offer a self-care presentation, a PowerPoint that we're going to send to everybody. It's something we did some time ago for our graduates that are attending a certificate in end of life. And we're going to just give it to everyone who would like to read through it or share it or use it, whatever, however you feel that it's good use of that presentation. So I understand my health benefits well. At least I believe so. That's a very good statement, Rachel. You may want to double check that because there might be something you're not taking advantage of. Those new open enrollment meetings are perfect opportunities to voice your question. And also it's important for everybody to try to help their employer improve their plans. Nothing is set in stone, and comments of employees are taken seriously. I've certainly Jennifer.
Yeah, and actually, I think that is a very good point in terms of helping their employer improve their plans. I think that benefits plans are created and are maintained and managed based upon feedback of employees. And if you either like certain things about your benefits or wish that there are other things that could be added to benefits, then I encourage you to have conversations with your employer. And if you, of course, there's more than one person in the household with more than one employer, then please have conversations with them, because employers can only provide what is asked for. And if it is not known that that is a desire or a want, then it can oftentimes get passed on. And so please have those conversations. That's important.
Right. We have one last question here. What about stress caused by interpersonal problems at work?
So that is definitely another stress that the EAP can actually help to resolve in terms of providing, opportunities and avenues to work those situations out. I think that interpersonal relationships at work also get to the point where you should definitely talk to human resources. You can talk to your manager. And I would say that the stress is caused when that communication doesn't happen. Someone's trying to deal again with an issue and not seeing any resolution to that issue, and having other venues to talk about.
And that goes into trust too. To be able to deal with some of the things, you need to have trust within the management organization to voice your concerns effectively.
And I think running underneath all of that is this kind of tension that I think we'll always have, because it's a part of life. And the tension is, what situations can I change on the one hand, and what do I have to adapt to on the other? Some situations may not change for whatever reason because of decisions of senior leadership or the nature of the work or whatever that is. So each of us has to kind of wrestle with this question about, where can I advocate for change and when can that happen? And where do I have to adapt to a situation that I don't have any control over?
Right.
And I think we are right on time at the end of our webinar. And information about the CEUs is on the chat box, and it's also going to be emailed. We are also going to email a tool, which is Resilience Building Plan Worksheet, so you can look at that and see how you can apply that in your own organizations. I want to thank the panel here. Teresa, Jennifer, Kip, thank you so much for participating today. I hope the audience got some tools out of this conversation. I'm going to turn it on to Teresa.
Thank you all so much. I want to thank our panelists and moderator Monica. If you guys have any questions, please feel free to email it to me. right now, if you can go ahead and complete an evaluation form, it shouldn't take you more than a minute, but your feedbacks are very important to us. They help us improve our future programs. So just to wrap things up, this program does count as an elective for Montgomery Hospice is a certificate in end-of-life care program. If you're not familiar with the certificate in end-of-life, it is a program we started in 2017 with the hopes of giving healthcare professionals a well-rounded education on end-of-life care and palliative care. It is a 10-course curriculum, 7 mandatory courses, and 3 electives. This, as I said, counts as an elective. For those of you who've signed up for continuous education credits, your CE certificate would be emailed to you within 2 weeks. And some of you did ask about general completion, certificate of completion. We'll be sending those out as well within the next 2 weeks. We also, the next slide tells you a little bit more about the programs that we have coming up. On March 12th, which is next week, we are offering 3 of our mandatory courses in one setting. That's in person at Aspenwood Senior Living. We still have a few seats available, so if you haven't signed up for it yet, you can do so now. And then we have another program in April, which we are very excited about, on bringing equity to end-of-life care, cultural humility, and advanced care planning. This is a program we're doing for the first time. It would be at Charles E. Smith Life Community Center, and we'll be providing more information and links to the registration next week. We have a very limited amount of seats for that, so we'll give our certificate in end-of-life candidates a priority for that. With that said, I hope you enjoy the rest of your day, and thank you for joining us.